Well, today's Bell Let's Talk Day
is Canada's biggest national conversation about mental health. This is the 16th year for the annual event, promoting mental health awareness and conversation. This year's theme is taking a moment for mental health, urging people to make self-care a priority and to check in on others. Bell is giving $10 million towards Canadian mental health, bringing its total Bell Let's Talk investment to $194 million since 2010.
And joining us live in studio to talk about Bell Let's Talk Day is the chair of the initiative, Deacon. Definitely you become a familiar face in Canadian households. 16 years is a long time, and boy, has this campaign grown, evolved, and changed and done a lot of good. Maybe you can take us back to the beginning and what was the catalyst for this in the first place?
So before I came to Bell, I worked in the area of mental health, and I used to talk about how wonderful it would be to find a Canadian corporation that would adopt mental health as its cause of choice. And Bell made that bold decision. I went to Bell, started with a blank piece of paper. I had no idea how the initiative would grow, but what I will say is it clearly was an indication that mental health was an issue whose time had come because it was embraced across the country and, in fact, around the world.
So, you know, we've seen conversations happen. Over the years, how do you think that conversation has changed?
I just think it has grown to be more, there's more openness, there's a greater number of conversations, more people willing to seek help, more people actually seeking help. And, you know, what that's doing is putting a strain on our already strained mental health care system, but I feel that's a good thing because we need to do a better job in ensuring that everyone in the country can get the mental health support they need.
And I have to admit, back when this started, you didn't so much hear people say, I'm going to take a mental health day. And now that's something where I don't think there is the shame that there once was, but certainly this initiative is not just one day. The conversation has to continue. Maybe we can talk about at this stage where some of the gaps remain, but also where the big successes have been.
Well, I'll start with the gaps. I would say the gaps really are in community mental health, right? The organizations that are in communities across the country where people are more likely to be when they need to take their first step. So community grassroots organizations often don't get much funding from government. They put every penny they have into helping people each and every day. So there needs to be a greater emphasis on upstream, early health, mental health care in community.
Obviously, this initiative is just really taken off and progress has been made, but is there a frontier that you want to see achieved or a place you want to see it go?
Well, I have a vision of a Canada where everyone can get the mental health support they need. The frontier for me is better upstream, early intervention and prevention. Now, those sound like jargony words, but basically what that means is at the first sign of a problem, you are able to get health. Or as Howie Mandel says, treat your mental health like your dental health. Take preventative action so that you really don't end up in the dentist chair needing to have your tooth pulled. So it's more about the preventative and early intervention so that less people end up in serious help in emergency departments, ultimately helping them have better and happier lives.
Well, we certainly admire and appreciate all the hard work you've done over these years. Is there something you want to leave people with before we let you go? I know it's a busy day for you.
So the theme this year is Take a Moment for Mental Health. And, you know, what that means is there are obvious things that you might think about, like meditation or breathing exercises, but it's much more than that. Exercising, being out in nature, digital detoxing, expressing gratitude, spending time, shared activities with friends and families. These are simple and practical things we can do each and every day that will help and support mental health and well-being, especially in these times when there's so much uncertainty in the world.
Great advice. All right, Chair and founder of Bell Let's Talk, Deacon, thank you so much for your time. We appreciate it.
Thank you.